Welcome to this session on recognising training pathways and supervision requirements for 5 key roles in primary care. In today's session, we will recap the 3 different types of supervision as defined by NHS England. This will be a brief reminder, and so if you have not already done so, we recommend reviewing the chapter on understanding the 3 different types of supervision before you begin this chapter. We will cover 5 chosen roles in primary care and focus on their training pathways, supervision requirements, and how they differ for each role. We will also signpost you to resources for you to find out more. The roles we've chosen are clinical pharmacist, paramedics, physician associates, physiotherapists, and practice nurses. Before moving into the 5 different roles, this slide is a quick recap of the 3 different types of supervision. Let's revise what good supervision looks like under each of these headings. For educational supervision in green, you will understand that the supervisee's skill set on arrival, identify learning needs, assess competency, provide training, and flag any problems. As a clinical practice supervisor or a day-to-day supervisor in orange, good supervision looks like being accessible in real time, minimising barriers for providing support, offering appropriate time to do supervision, and promoting a culture of asking for help. As a professional supervisor in the red column, your role is to know a supervisee and their strengths, weaknesses, and interests. Know their competencies required for their role and provide protected time for learning, promoting trust and well-being. We explore the training pathways in more detail. I invite you to consider a time when you have supervised someone from a role different to your own. I will read through the guided exercise. Please pause at any time to complete the activity at your own pace. Start in the first column by listing the different roles at your practice, underlining those who you have supervised before. Next, list factors that make supervising that individual straightforward, and another list of challenging factors. It is possible that you've not had the opportunity to supervise someone from outside of your role yet. In this case, imagine what the possible straightforward or challenging factors might be. Lastly, think about what other information would be helpful in the supervision contact to reduce any challenges. Interprofessional supervision has been a topic discussed throughout the series on supervision. Here are some of the factors that have commonly come up in those discussions. When we think of potential challenges, it is recognised that supervisors may lack knowledge about other professional training pathways. It can be challenging when supervisors do not know what to expect in terms of a supervisee's capability and competency at each stage of training and even post-registration. Some supervisors have fed back that they feel uncertain about trusting the supervisor's knowledge or clinical skills and have felt uncertain with managing that risk. On the bottom of the slide, we have outlined some resources where you could find out more information to help overcome some of these challenges. Each of the 5 NCL boroughs has a multi-professional educator group, known as an MPEG, with a named contact who leads on the delivery of workshops for supervisors. Further details, including contact information about these MPEGs, is at the end of the chapter. Arranging a meeting between supervisor and supervisee early in placement can help identify learning needs, which should include competencies and capabilities. There are also frameworks for each profession, which include more detail on what to expect of the supervisee at different stages of training and post-registration. For the rest of this chapter, we will summarise for each role the training pathways, supervision requirements, and where to find further information. In this section, we will explore training pathways and supervision requirements for clinical pharmacists. We will also signpost to further information. This slide shows the training pathway of a pharmacist in the early years. The first step to becoming a pharmacist in the UK is completing a Master of Pharmacy degree. This is a 4-year undergraduate programme accredited by the General Pharmaceutical Council. The programme covers various aspects of pharmaceutical and clinical pharmacy. Following this, one must complete the Trainee Foundation Year, which is a structured work-based training programme designed to implement the skills learnt at undergraduate level and consolidate the technical, clinical and consultation skills required to be a competent and autonomous pharmacist. The foundation training needs to be in a patient-facing environment and must also include a traditional dispensing environment. Historically, this meant a community pharmacy, hospital environment with a dispensary, and a select few may have enjoyed a split year working in the pharmaceutical industry. More recently, general practice has been included as a suitable environment. But since dispensing is a requirement of the core training, the trend is now towards a multi-sector training year, which may include placements in a dispensary or split rotations in general practice, prison services or mental health trusts. Those who have trained abroad would need to complete a 1-year overseas pharmacists assessment programme, followed by the foundation training year. Currently, the initial education and training of pharmacists is undergoing significant transformation, and this is in preparation for 2026, when all pharmacists will be qualified independent prescribers at the point of registration. This accreditation will be incorporated into the foundation training year from 2025. The diagram shows both pathways. Following the foundation training year, you would complete the registration exam, and if successful, you would apply to be included on the GP pharmaceutical register. This is when the fun really begins, and the pharmacist has an opportunity to work in a range of different settings. In general practice, a newly registered pharmacist, or a pharmacist new to general practice, would still be considered a trainee within that environment. Pharmacists employed under the ARS roles must complete the CPPE primary care pathway, which is an 18-month programme and requires protected learning time. In most cases, for most pharmacists undergoing this programme, who are not already independent prescribers, they would complete the independent prescribing qualification at the end of this course. Here we see the picture of a more experienced pharmacist. A senior pharmacist may be an individual who has had several years of clinical experience, but in most cases will usually have additional responsibilities, which may include direct line management of other staff, education and training, or clinical supervision. Pharmacists may also want to pursue further study at postgraduate level, which may include specialist training in various clinical or non-clinical areas. Depending on the type of training or education undertaken, the pharmacist may specialise in a particular field, such as diabetes, respiratory, or cardiology, which means that they may see higher risk or targeted patient groups as a specialist pharmacist. An advanced clinical pharmacist is likely to be a generalist who manages more complex patients and may have a higher degree of clinical responsibility within the practice. These are not protected titles and in many cases may be interchangeable or overlap. A lead pharmacist may be managing an entire team, a department, or specialty. Some pharmacists may choose to develop their clinical skills further and take that advanced practice route, which requires the completion of a postgraduate master's or completing accreditation through the e-portfolio route. The Advanced Practice Pharmacist is a protected title. We can now look at the specific supervision requirements of clinical pharmacists. Let's look at the pre- and post-registration, as well as the requirements relating to the types of supervision. For a pre-registration pharmacist, the practice or PCN must ensure that a designated supervisor is in place who must be a pharmacist with at least 3 years of experience and ideally be an approved educator. For anyone completing the independent qualification for prescribing, whether that's pre or post registration, they will require a designated prescribing practitioner supervisor. And this individual can be a multi-professional, but they must be an active prescriber working within an appropriate prescribing environment. With that, it's also vital to ensure that the designated supervisor or the prescribing practitioner have capacity to support the foundation trainee pharmacist or trainee independent prescriber, which requires scheduled and protected time for feedback and supervision. You may notice that the supervision of a pre-registration pharmacist is heavily reliant on supervision carried out by pharmacists. The designated supervisor will be responsible for the overall supervision of their trainee, although some elements of the day-to-day clinical supervision can be carried out by multi-professionals. It would be encouraged to access supervision from GPs, advanced practitioners from other backgrounds, such as nurses or paramedics. Looking at the supervision requirements for post-registration pharmacists, you will see that whilst multi-professional supervision features more heavily in the post-registration phase, supervision delivered by senior pharmacists is critical to the development of the pharmacy workforce. The DES contract specification is very clear on supervision requirements for pharmacists employed under ours. It states that all clinical pharmacists must have a named GP clinical supervisor. In addition to this, a newly qualified pharmacist or one who is newly entering general practice, referred to in the DES as a junior pharmacist, must have access to a senior or more experienced pharmacist who should deliver a minimum of 1 supervision session a month. The ratio for senior pharmacist to junior pharmacist is no more than 1 in 5. A senior or more experienced pharmacist would require a minimum supervision session of 1 every 3 months, with a GP clinical supervisor. The requirements of educational supervision will be dependent on the individual accredited course and hence may differ between course providers. Professional supervision may be multi-professional. However, pharmacists advocate that in the early years it may be best provided by a pharmacist who can help with career and skill development, particularly in identifying gaps in knowledge and areas of interest. You may be wondering about clinical competency of pharmacists. Those who have been enrolled onto the CPPE primary care education pathway will have access to the Progression Handbook, which gives a brief summary overview of the competencies expected at different levels of clinical practice. This framework does not include advanced practitioners. Further information can be found at the end of the chapter. All prescribers, including pharmacists, should adhere to the RPS competency framework for prescribers. Further information about this framework is available at the end of the chapter. On this slide, we can see and understand who can supervise who in primary care. A GP can supervise any of these roles, but must have undertaken the GP supervisor course and completed training hub approval. Only GPs can supervise a physician's associate. Otherwise, anyone from any professional role, as long as they've undertaken the London Multi-Professional Supervisor course, can supervise, for example, a clinical pharmacist, paramedic, physiotherapist, or practice nurses. Please note the subtle difference with MSK first contact practitioners, where their educational supervision is provided by the higher education institutes. For further information about supervision requirements, please access the resources at the end of the chapter. Any of the 5 roles discussed may progress to become advanced practice practitioners and can come into contact with patients from an undifferentiated list. Early this year, a revised version of the Workplace Supervision for Advanced Practice was published. In broad terms, the document emphasizes that supervision is an ongoing process and has no finite end date. There is an emphasis on it being multi-professional and flexible, where the supervisors must be capable to supervise the relevant domain. It makes the employers more accountable for the provision of supervision of quality and ensuring time is made for it in the supervisee's day. There are clear recommendations for the employers too, such as a requirement that ensures 1. Appropriate supervision arrangements are in place. 2. Supervisors have access to learning and development opportunities, enabling them to provide effective supervision. 3. Advanced practice workforce and business planning includes identifiable provision of supervision. 4. Advanced practice workforce and business planning includes identifiable investment in supervisor development. There are also 2 new terms to help describe supervisors. One is the title of Coordinating Education Supervisor, who is a primary supervisor. The other is an Associate Workplace Supervisor, who is a more supportive role. There may only be one Coordinating Education Supervisor, but there may be many Associate Workplace Supervisors. I will explain this more in the next slide. The Coordinating Education Supervisor provides overarching supervision and coordination of the learning of the supervisee and is able to oversee the progression of the supervisee. In contrast, the Associate Workplace Supervisor provides more targeted support with a focus on specific areas or topics or skills. Together, they ensure safe, effective development to advance practice. To summarize what we have learned in this chapter, we have talked about and listed potential challenges when supervising someone from a different role. You have an awareness of training pathways of the 5 different roles, an awareness of supervision requirements for each of those roles, and you should know now where to find supervision guidance for any of those roles who are taking on advanced practice. At the end of the chapter, you will find further resources and support. Before you finish the chapter, take a moment to think. What do you want to revisit or explore in more detail? What will you do differently because of this learning? Consider making an action plan in your appraisal or discussing it at your next workplace review.